Hi everyone, today we talk about ultrasound. But first, we need some sort of clumsy analogy to the animal kingdom. I figure basically we can compare ultrasound to the echolocation abilities of either rats or dolphins. But which one will it be? Let's spin the big wheel! Come on, big money, and it is dolphins! Congratulations to our winner, and thank you, Bats, for playing our game, but you won't be going home empty-handed. Johnny, tell our runner-up what they've won.
Well, Josh, all our contestants will be taking home the home version of Bats or Dolphins. That's right, now you can enjoy all the high-stakes excitement of Bats or Dolphins in the comfort of your own family room. Spin the wheel. Will it be Bats? Will it be Dolphins? It can only be one. Unless, of course, the spinner gets stuck in between the two or some of the stickers fall off. We're still working with the manufacturer and some quality control issues. Bats or Dolphins from Parker Brothers.
Thanks again for joining me. I'm Dr. Josh Jarvis, and today we're going to talk about ultrasound. But before we get too far into it, I thought I'd try something a little different. While I'm incredibly thankful for my small family of subscribers, I'm always looking to reach a wider audience. So I thought to myself, what's the big thing that all the cool kids like to watch these days? Well, that's simple. People love to watch other people play video games. So, in addition to teaching you all about ultrasound, today I'm also going to play some video games. I'm sure the whole thing will be seamless and not at all awkwardly shoehorned in. But what game should I play? Well, there's really only one option. The game that everybody is talking about. The game that's become a cultural phenomenon. The game that if I put its name in the tags, I'll get millions of views. Okay, so I've got my headset and my Code Red Mountain Dew. Let's play some Echo the Dolphin. Alright, so I guess basically you're just a dolphin swimming around. Fish here. Alright, so I'm gonna try to see where I need to go. Let's see. There's nowhere really to go down here. Let's see. Let's see if I can bash my way into there. There's these rocks here. Ooh, come on. No. Okay, so at this point I'm kind of stuck. Can't really go anywhere. But you know, maybe that's just what this is. Maybe it's just a dolphin simulator. Just kind of swim around, do some tricks. Okay, so I jumped in the sky, and then a vortex came and swallowed all my friends. Oh, that makes sense. Oh, hey, those rocks are gone. So, you know, it's not all bad, you know. Okay, so Shamu's here. Not sure if I'm supposed to fight him or talk to him. Oh, hey man, we just met. I'm not sure if I'm comfortable talking about my pod. Shamu is gone. Alright, we got this big crystal here. Hey, speaking of crystals, why don't we talk a little bit about ultrasound? Okay, so what does ultrasound have to do with dolphins and crystals and all that? Well, dolphins can use echolocation, also known as biosonar, to detect things in their surroundings when visibility is poor. By emitting high-frequency sounds or clicks, which bounce off things around them, dolphins can determine how far away things are based on how long it takes the echoes to come back, as well as information about what types of things are in front of them based on how strong the returning echoes are. For example, a strong returning echo might indicate something large and solid like a stone wall, and weak returning echoes might indicate smaller or softer things such as a school of fish, which might absorb or scatter the sound waves. Ultrasound basically works in the same way, except your body is the ocean and your liver or whatever is the school of fish. Inside the ultrasound probe is a crystal which, when electricity is applied, will begin to expand and contract, producing high-frequency sound waves beyond the audible range for humans. That's why it's called ultrasound. The ultrasound crystal also has the ability to convert high-frequency vibrations, such as ultrasound waves being reflected back, into electrical signals. This is called the piezoelectric effect. And so, by alternating between applying electricity to the probe to emit ultrasounds and turning off the electricity to listen for returning ultrasound waves which are turned into electrical signals, images of the body can be made. But what kind of information can ultrasound provide? Well, first, there's distance or depth. By measuring how long an ultrasound pulse takes to bounce back to the probe, the distance to whatever structure reflected the pulse can be determined. Closer structures take less time for the sound to bounce back, and farther structures take more time. We can also get information about what structures are made of based on the strength of the returning ultrasound pulse. Certain materials and tissues allow ultrasound waves to travel through them to different degrees. This is called acoustic impedance, which is the resistance an ultrasound beam encounters as it travels through a given tissue. Certain materials can absorb ultrasound energy, transferring it to heat, or scatter the ultrasound beam, which will weaken the returning signal. So, ultimately, it's the different physical properties of the various tissues in the body that determine their ultrasound appearance. Let's take a look at a few examples. Water or simple fluids such as urine or bile allow the ultrasound beam to pass through very easily. So much so that little to no ultrasound waves are reflected from inside fluid-filled structures, as we can see in these ultrasound pictures of a normal urinary bladder and normal gallbladder. These structures show up black and are referred to as anechoic since no ultrasound echoes are reflected from them. Blood vessels also are typically anechoic on standard grayscale ultrasound. Soft tissues such as the solid organs tend to be denser and more heterogeneous, causing the ultrasound beam to both reflect back toward the probe as well as scatter more diffusely. These structures show up in varying shades of gray depending on their composition, as seen in these ultrasound images of the liver and kidneys. Bones and other dense calcifications allow essentially none of the ultrasound beam to pass through, resulting in a strong reflected signal that shows up bright white, such as in these images of the surface of a bone and in these calcified gallstones in the gallbladder. Note that there's a dark black area beyond these structures, which is referred to as shadowing. This occurs because the ultrasound beam is stopped and maximally reflected at the surface of the dense calcified structure, preventing ultrasound waves from traveling any deeper within the body. The ultrasound beam also has a terrible time traveling through air or gas. This means that evaluation of air-filled structures such as the bowel, as well as looking at deeper organs beneath the bowel, can be significantly limited if there's a lot of overlying bowel gas. So it's just basically swimming around doing normal dolphin things, talking to crystals, pushing glowing shells around to break rocks. Oh my goodness. Oh my goodness. Pufferfish are really aggressive. Oh my goodness. Okay, so I talked to a crystal who said that I need to swim really slow past this octopus. Jeez, come on. Come on. Jeez, come on. Why you gotta be like that, octopus? Come on. There you go. Uh-oh, now I'm running out of air. Pufferfish! Jeez, oh god, the pufferfish. Oh my gosh, the pufferfish. Oh my goodness. Okay, so now that we know the basics of how ultrasound works, let's talk a little bit about its uses. One of the main uses is evaluating the solid organs of the abdomen and pelvis. Here's an ultrasound image of a normal liver. And here's a patient with cirrhosis, which is severe chronic liver damage and scarring, most commonly associated with alcohol abuse. You can see that the liver with cirrhosis has a much more heterogeneous appearance with a bumpy, nodular surface as compared to the smooth contour seen in the normal liver. Here's a normal gallbladder. And here's a patient with acute cholecystitis, which is inflammation of the gallbladder typically due to obstruction by gallstones. You can see that with acute cholecystitis, the gallbladder becomes thickened, often with reactive fluid surrounding it. Shadowing gallstones are also noted. And here's an ultrasound of the pelvis to evaluate the uterus and ovaries. On the left, we have a normal ovary, and on the right, we have an ovary with a large cyst. Ultrasound is also great for evaluating blood vessels in the body using a technique called Doppler ultrasound. You know how when a train is coming toward you with its horn blowing, the pitch of the horn changes as it passes you? That's called the Doppler effect, and it occurs because the perceived frequency of the sound coming from the horn changes as it's coming towards you, passes you, and moves away. Well, if you replace the listener with the ultrasound probe, the train with the blood in a vessel moving toward or away from the probe, and the horn with the ultrasound signal reflecting back from the moving blood, we can do some math with angles and such to figure out both the direction and speed of the blood flowing within the vessel. When the ultrasound machine is set to color Doppler mode, the vessels turn from black to red and or blue depending on if the blood is flowing toward the probe or away from it. This can be helpful in evaluating whether certain organs are receiving adequate blood flow. Sometimes the ovaries or testicles can twist on their attachments, blocking the flow of blood. This is called ovarian or testicular torsion, which is an emergency because without blood flow, the ovary or testicle will die, which can impair future fertility and generally is very painful. Ultrasound allows for evaluation of blood flow so that patients with torsion can be quickly taken to surgery to fix the problem. The ability to measure blood flow velocities can also help in detecting areas of significant vessel narrowing, commonly due to atherosclerosis, which is a hardening of the arteries with the development of plaques, which can block some of the blood flow. This vessel narrowing causes the velocity of the blood flowing within it to increase. Think of how fast water comes out of the end of a hose when open versus blocking part of it with your thumb. Here are some images of the normal internal carotid arteries, which supply much of the blood to your brain, compared to the carotids of a patient with significant vascular disease. The blood flow velocity in the diseased carotids is greater, suggesting significant narrowing. Lastly, ultrasound can be super helpful in performing procedures such as taking samples of abnormal tissue or draining fluid collections. The radiologist performing the procedure can hold the ultrasound probe in one hand and the needle in the other to watch the needle enter the structure of interest in real time. Here are some images from a biopsy of a mass within the breast. You can see the mass and the needle going into it. Oh, there's sort of a ring here. Let's check this out. Whoa. Okay. So, well, that's interesting. There's like these, I'm not entirely sure that, oh, what? I'm not sure what's going on here. Just, you know, dolphins. And there I go. Some kind of... Ah! Oh my god! Holy crap. Oh my gosh. 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 Ah, what are these things? I do not like those. What? What? That is a dinosaur. Wait, what? Can you look at this? I'm a dolphin sticking my head in a volcano. Look at this. Look at this. I cannot get over. Look. Okay. Alright, just leave me alone. I'm making fun of this volcano thing here. Alright. So now that we know some of the clinical uses of ultrasound, I wanted to quickly mention some of the advantages and disadvantages. One of the biggest advantages is safety. Since ultrasound uses high-frequency sound waves and no radiation, it can be a great option for children and pregnant women where something like a CT scan would be more risky. Ultrasound is also readily available in every hospital and many clinics and is generally cheaper than CT or MRI. Ultrasound also has the benefit of real-time evaluation of structures and imaging problem solving. While the ultrasound tech or radiologists are scanning, they can watch active processes such as peristaltic bowel, ureteral jets in the urinary bladder, or gallstones rolling around in the gallbladder. Also, if they see something strange elsewhere while scanning a certain part of the body, they can move the probe around to further evaluate it. And if there are structures they can't see well, such as an organ obscured by bile gas, they can actively move the patient around to try to get a better angle. This, of course, requires a certain amount of skill in the ultrasound tech or radiologist, which can be a disadvantage. Since the pictures are being taken by a person moving the probe around and optimizing the angles and settings, image quality is largely determined by the skill of the operator. While thankfully I haven't experienced it much with the ultrasound techs I work with, making an accurate ultrasound diagnosis can be greatly impaired if the tech takes poor pictures, isn't able to find structures, or ignores findings that could be important. Lastly, ultrasound has definite limitations in assessing fine detail, particularly within deeper structures. If the patient is very large or there's a lot of bowel gas, ultrasound may provide little, if any, useful information. Sometimes CT or MRI is a better option. Okay, so this place, oh my goodness, what is this? There we go, just sonar. His head is coming after, oh my god, his head's coming after me. Okay, I think he's, get the head, okay. Alright. Okay. Oh! The walls are just like moving around me here. Okay, I'm getting shot by like peanut clusters here. Oh my gosh. Alright, go this way. Go up. Go down to the walls! Ah! Why? Okay. I think this is the final boss. So, I'm beginning to think that this isn't the straightforward dolphin simulation that I was expecting. Let's see what we can do with this. Alright, like shooting out these blobs. Over here. Oh my gosh, it's trying to eat me. Get him. Ah, his eye popped out. Alright, let's go this way. Try working on that other eye. Oh, jeez. Oh my gosh. Get him. Oh my gosh, I'm almost dead. His other eye popped out. Oh! Thank you so much for watching. Hopefully you learned a little something about ultrasound and dolphins. Before I go, I wanted to show you this really quick. I was trying to figure out how to play this game, so I downloaded the original manual. Check out the ad on the last page. Can't make this stuff up. Thanks again, like, comment, and subscribe, and make sure you check out my other videos. I'll see you next time. Tune in next time for more Bats or Dolphins. My life is a lie.